And then she will let me know if you get the answer, so we'll announce the winner. Dr. Dayton Campbell, General Secretary of the People's National Party, welcome to the hotline.
Hi, top of the afternoon to you and good afternoon to your listeners as well.
Thank you so much. Good to have you. I call you about the press release that the PNP sent out, issuing urgent call for action on maternal and neonatal healthcare crisis in Jamaica. Firstly, can I ask you to tell me the period to which you make reference when you say maternal mortality rate in Sarah has skyrocketed from 27 per 100,000 to an unprecedented 273 per 100,000. What years are we talking about?
Right, so the information that we have been relying on was presented by the Minister of Health in a document that he publishes called Vital. And in that document, we just simply extracted the chart that he has in it. In 2000, the maternal mortality rate
2000.
was, right. The maternal mortality rate at that time, I think, was 26.8. Let's call it 27 per 100,000. And in 2022, it went up to 273 per 100,000. So that is the source of our information from the document presented by the Ministry of Health.
Let me see if I have this document here, because I just have the permanent secretary who says she doesn't know this number at all, 273.
I can send it to you.
Yes, I think I may have seen it.
The minister held it up yesterday and said that the document is theirs and the information wasn't a discovery, that they put it out. That's what he said yesterday during his press conference. I tweeted something, and he also responded by publishing by showing a picture of the document and saying that the numbers are there.
So the figures you're telling me now, the 27 which you've quoted in the press release, that was 2000 and
right.
2022. So over a 22-year period, it moved from 26 to 273 per 100,000. You can
see the different numbers, but essentially that is where it was in 2023, in 2022, and the country's number would have gotten worse. I think the country's number is in the 150, and ideally, the CMO said it. They want it to be less than 70. And
hold on, I think I have that document that you're talking about here. Is it on page 13? Open yours and let me just see if it's on page 13 of the document called Vitals.
Hold on.
Yeah. Because this is titled Maternal Mortality in Jamaica 2000 to 2022.
I'm not sure of the page because I don't have the document right in front of me. I'm trying to bring up something, but
yes,
the numbers that are in the release are accurate. We double checked it. It was at 26.8 in 2000 and then went up to 273 per 100,000.
Because I'm looking at the document called Vitals, and I'm on page 13, the soft copy, and what I see for 2000 total maternal deaths is 47, and for 2022 I see 49. So I just want to know where exactly you got this particular information from. And it doesn't ring a bell to the chief medical officer when I spoke with her a moment ago. So look on the electronic copy, page 13, and see if that's...
20. Page 20.
Okay, let me scroll to page 20 and see.
Page 20 spoke to the number of deaths that were due to COVID, and let me see the page that speaks to the overall numbers.
Yes, I see page 20, COVID-19 maternal deaths by the health region.
Right.
So for South Regional, 19, and 11 were attributed to COVID, and the number of live births and so forth. Yes, I see that one.
And this is page 4 and page 5. Maternal mortality statistics at a glance.
Page 5. All right, let me see if I find this. Okay.
Maternal mortality statistics at a glance.
Right, so 2017 number of maternal deaths 33.
Right. No, so at the bottom you see SRHA, Southern Regional Health Authority. 2017 it was at 26.8 per 100,000, and 2022 273 per 100,000.
Mm-hmm. Okay, I see that now.
Right, so that's where I got the information from.
Okay. All right.
which is alarming. I mean, by any stretch of the imagination, it is alarming. That's a tenfold increase in the number of maternal deaths. I heard at the press conference where reference was made to COVID, but in the other sheet that page 20, in 2021, 11 of 19 deaths were due to COVID, and in 2022, only 2 of 18 were due to COVID.
Yes.
So COVID doesn't explain it.
Right. So, but let me ask you now, as a medical doctor, and I said it this morning, and I heard the chief medical officer saying it at the press conference. What do you think any government can do, as desirable and as noble as the developmental goals are, to get maternal deaths below 70 by 2030? What can any government do when people eat as they please, do not do as much exercise as they should? Many people are in a stressed state daily and just don't even know how to bring their stress levels down, leading to all sorts of diseases by the time, non-communicable, by the time they get to late 20s, early 30s, which are usually the childbearing age. What can a government do to get anybody in a state of health to be bringing children into the world without the complications that can lead to death?
Government can do a lot. As a matter of fact, I find it very offensive, the approach being taken by the ministry. It is not known that people have been eating a particular way. Is it that the government is admitting that the society is under severe stress, where people's health are deteriorating suddenly? Because this is the same population we've been dealing with over the years.
No, it's changing.
Hold on. It is the same Jamaican people that we're dealing with in 2017 when we had it at 26.8 in the Southern Regional Health Authority. It's the same Jamaican people that are there. The Ministry of Health has a responsibility. When a woman gets pregnant, they have antenatal care, where you go to clinic whilst you're pregnant. Certain of you're monitored.
What if they don't go, Dr. Campbell? What if they don't go?
So that's one thing. But then you have the healthcare model that you practice within a country. We have continuously said that we need to move to a primary healthcare focus, where we seek to prevent things other than seeking to treat things. I don't think it is appropriate for the government just to say this is because people are not eating properly. That's certainly
no. I don't think that's the only thing at all.
Right. So the government has a responsibility. Health education, health promotion is the responsibility of the government.
Yeah, but when he goes with his Jamaica Moves program, you guys complain that the minister is into PR and not building enough hospitals and everything.
Necessary but not sufficient. We've always said that. It is necessary but not sufficient. If you think about it, Jamaica Moves could never be the solution to the problems that you're having. You don't have to reinvent anything. You do have societies out there. Cuba is one of them that is close to us, right? Where there's a primary healthcare model where you ensure that persons within their communities, they're assigned to physicians, you ensure that these people are...
Cuba is not a model that we follow because it's a completely different makeup. They do not operate a democracy in Cuba, right? We have absolute free will. How do you get a young lady who is pregnant to go to antenatal in the way that you're suggesting if she's decided she's not going to go?
Well, I am not giving up on my people, and I am confident that if there's proper health education and promotion, that you can get females when they are pregnant to go to the healthcare facilities and for them to be monitored. I am confident in that, right? I'm not at a point of giving up on our people to write them off, to say that our people are just not seeking healthcare and they're not doing this, they're not doing that. I do not agree with that at all. For my time as a practicing physician, what I do know is that if you make healthcare accessible, if people are able to go to the health centers within their communities and see a doctor, they will go. Maybe it is that they're not going because they don't have a doctor available in some of the health centers that are out there. Is it that we've worked out so that we can get a proper health insurance scheme in the country so that people could go to their private facilities?
You are proposing a health. You're proposing a health insurance scheme that the government is to pay for?
We have always proposed a national health insurance scheme.
Okay.
You do have NHF and other things that you could use, but we've always proposed that. That's something that the PNP has always said.
I have to come back to you next week. I have to come back next week again. A lot to drill down to. I see the stats you say. Thank you so much, Dr. Dayton Campbell. Talk again.